www.healthcmi.com. Acupuncture Continuing Education online today. Let's take a look at a very special article entitled COVID-19 Coronavirus Chinese Herbal Medicine Outcome Improvements. So go to healthcmi.com, click on news, and look for the article of this title, published August 10, 2020. Acupuncture and Chinese herbal medicine for the treatment of COVID-19 is safe and effective. Researchers determined that specific herbal formulas demonstrate purity, potency, and efficacy. In addition, signs and symptoms were relieved using acupuncture and herbs for coughing, fatigue, and fevers. Researchers from the University of Texas Health Science Center in Houston published this material in the Journal of Emergency Medicine, actually the American Journal of Emergency Medicine. Let's see what they say. The doctors from Texas note, Chinese medicine, quote, is an essential part of the armamentarium to treat these COVID-19 patients in China, and that this approach to integrative medicine may facilitate treatment at ports of entry for patients, which are often emergency rooms. They also note that, quote, Chinese medicine significantly increased viral nucleic acid negative conversion rates. So really interesting stuff that they find. This was a meta-analysis of 2,275 COVID-19 patients in 2020. And what's amazing about this article is they list a lot of the herbal formulas and even the patent medicine pills that people use in China, a lot of it reimbursed by insurance. So an acupuncturist can take a look and see the individual herbs within formulas, and consumers can really get a handle on what's happening. The meta-analysis, let's see, it improved CAT scans of the lungs, clinical cure rate, treating, and that included treating actually mild to critical cases. It improved reducing the length of the hospital stay, total symptom scores, reduced cough, number of fatigue reduction cases was increased, so much less fatigue. And of course, viral nucleic acid testing was superior, and a reduction of inflammatory biomarkers, including C-reactive protein. So a lot going on there, and it gets right into the herbal formulas like Qingfei Toshi Fu Zheng, Shu Feng Jiedu capsules, Lianhua Qingwen capsules, etc. We even highlight one of the custom formulas, so acupuncturists really might like to take a look at this article. Essentially what's happening in China is it's working and it's been integrated into the system. They've done the homework, they've done the research, and they found that one, it does prevent the virus from replicating, and two, it's good for symptoms like coughing and reducing fevers, things like this. And it's preventing people from dying, and the homework is being done. They pumped a lot of money into the research and then implemented those findings in terms of clinical applications. So there's Chinese herbal medicine pharmacies installed at a lot of hospitals now, and 8,000 hospitals already had Chinese herbal medicine pharmacies ready to go. And that's been increased, and insurance coverage, because of the research in China, is covering a lot of the over-the-counter medications as well. So that's also very interesting. So the Chinese have had a integration of Western and Eastern medicine, as we term it here in the United States. In other words, people are still getting oxygen, they're still getting the bed rest, they're still getting Remdesivir or whatever drugs they need, ventilation, all of that. But in addition, they're getting the acupuncture and herbal medicine, and particularly the herbal medicine, and they're getting results. And this is evidence-based medicine based on the research that's being done. Obviously, it takes a lot of time to get research together, and there's more and more studies being compiled. Already, this one was based on a sample size of 2,275 patients. Now, this is springboarding off of research done in 2003, right? For the first coronavirus, the SARS that came out then hit China very hard, and they did a lot of homework then. So some of the herbs were developed for that and then applied once again for this strain, the COVID-19, the novel coronavirus, or SARS-CoV-2 as it's called. So it's being reapplied and tested again and finding good result here. So really a beautiful study, because if you take a look, you get a lot of the herbal medicine information in there and some of the treatment strategies that they're going for. A lot of the herbs are going after wind heat, which is what we call an external pernicious influence attack, which you would say in Western medicine, what would be wind heat? Kind of the first stage is the common cold or flu, basically. We get the sore throat or the chills and the headaches and all of that. Then a lot of the herbs treat damp heat. So that's your toxic phlegm, things like that. So treating those kind of infections with mucus or phlegm, things like that. Also, Shaoyang stage illness is treated in a lot of the herbal formulas. You see herbs like Chao Guo. So how do we translate that into Western thinking? That think about fever, but also chills. So they're kind of polar opposites, but they're alternating. So for conditions like that, the herbal formulas to address that. And then heat toxins. So just straight antiviral, antibiotic herbs also. And there's something else involved here, which is also pointed out. Herbs like Baishao, Dangshan, and Hung Jing Tian are included to address the severe fatigue and low blood oxygen levels. And Hung Jing Tian really has caused quite a wonderful fuss over the recent years. It's a Tibetan herb, now popular in China. A lot of initially they found monks using it, and they had a lot of energy at super high altitudes. And a lot of the research went into how does this help improve endurance, and athletes started using it. They found that there's better oxygen absorption, and this is a big problem with COVID, is low oxygen blood levels. So the Hung Jing Tian helps with that, and it helps energize the patient. So it gives them a lot of energy and improves the oxygen level, so it prevents them potentially from dying. So these herbs are also added, and that's all covered in this article. Well, I hope you enjoyed that kind of brief overview of this recent study published in the American Journal of Emergency Medicine. Thank you for listening. www.healthcmi.com